Now let's bring in a medical doctor at the Basildon University Teaching Hospital in the UK, Dr. Femi Oyekan. He joins me live from London. Thank you for joining us on TVC News at 7.
Yeah, thank you, Femi, for making me part of the conversation. Yeah.
So there's been a lot of talk about how challenging this time is for health workers who are indeed at the front line of fighting COVID-19. But help us understand just how risky the job is. With all the personnel protective equipment, is it a matter of inevitability that health workers will contract the virus?
First, I'll say that it's not a matter of inevitability that health workers will contact this virus, but the risk is very high. That's the truth. So, the Minister of Health rightly said that you must first be aware of how to use the personal protective equipment, and you must have, like here in UK and across Europe, there is an update that comes up every 12 hours, because what we know about the virus itself changes almost every day. Like today, from China, we just heard that there are now 33 mutations, and that the most virulent ones are in Europe. That's the virus has now changed itself in like 33 forms, which makes it quite pathetic. But the peculiarity of situation in Nigeria.
Hold on, Dr. Oyekan. What does that really mean for the impact on people who contract the virus? I'm talking about the mutation you mentioned now.
Yeah, the mutation means that, like going back to your first questions, that you must strictly adhere to those hygiene method of hand washing. Wherever you work in the hospital, a cleaner, a doctor, a nurse, you must use your face mask. It's not negotiable. And you must ensure that even if you are coming back home, whatever you used in the hospital stays in the hospital. And when you are coming back home, you're a totally different person. Now, going back to your second question about mutation, the mutation means that even if we have known coronavirus as a virus that has potential to kill, has potential to cause devastation, the new changes means that whatever we have been doing to study this virus is now changed in 33 different ways. That means that even if they're talking about producing a vaccine, it is going to be a lot more complex. Coming up with a vaccine that covers this larger umbrella. So in a way, the self-isolation must continue, the personal hygiene must be strictly adhered to, and all workers must be ensured, even patients coming to the hospital must be told to use face masks, because...
I get your point, Dr. Oyekan. Let's talk about the recommended relationship that must exist between health workers and their families, because after work, they will have to go back home. Does the hand washing, social distancing apply in this regard, even at home?
Well, for me, I'm one of the people that work very close to the accident and emergency, where it's considered high risk. And I have a 2-month-old child, so I try to, as much as possible, do it in such a way that before I leave the hospital, I try to ensure that all the personal protective equipment are left in the hospital. My personal changing clothes, which is in my cupboard, is different from once I get into it. I get into the car. When I get home, I make sure that before any of the kids come to say, "Welcome, Daddy," I've already cleaned myself, washed myself, and ensure that every protocol is strictly adhered to. This is what I've been doing at least for the last 3 months that I've been part of the front line, and this is what I think that most of my other colleagues too have been doing, and this has really helped us in a lot of ways. So what I will tell Nigerians is the fact that there is no way you can say that the coronavirus is there out to the public. Doctors and nurses, health workers are not going to go to work. We're going to go to work, and we're going to confront this monster. We must do it cautiously. We must do it responsibly. We must do it with the greater sense that we owe the public a sense of responsibility. Absolutely. And our families are also important to us.
We're going to have to leave it there, Dr. Oyekan. Thank you for the work you're doing, even though you are fighting COVID-19 outside the shores of Nigeria. But we will thank you and your colleagues back at home who are indeed working for Nigerians. Dr. Femi Oyekan is a medical doctor at the Basel University Teaching Hospital in the UK. Thank you for talking to us tonight.